everyone, in this video we'll be discussing about the menstrual cycle. So menstrual cycle, it is of 3 phases. The first phase is the menstrual phase. This phase lasts for about 3 to 5 days or sometimes 7 days. The second phase is the follicular phase. This phase lasts for about 12 days or sometimes 14 or 15 days. Then occurs the ovulation. Now, once this ovulation occurs, this luteal phase starts and it is a constant phase. Follicular phase may depend on different women, but this luteal phase, it is a constant phase. Now let's start. So first of all, with this graph, look here, from day 1 till day 3 or 5, it is the menstrual phase. Then comes the follicular phase and the luteal phase. Okay, clear, done. Now about the basal body temperature. This basal body temperature, it is lower in the follicular phase, whereas in the luteal phase it is higher. Okay, now about the hormone level. So as the name follicular phase, remember the main role is of FSH. In this follicular phase, the main role is of FSH. FSH is actually follicle stimulating hormone. So as the name follicle stimulating hormone, it will help the Graafian follicle to grow. Here you can see this Graafian follicle is growing in response to the FSH. Now from where is this FSH coming actually? So look here, from the hypothalamus, this GnRH is released and it will act on the anterior pituitary, and this anterior pituitary will now release FSH. Just remember till here now. What happens? Hypothalamus will release GnRH. GnRH will act on the anterior pituitary and anterior pituitary will now release FSH. And this FSH will help the Graafian follicle to grow. Okay. But if you notice here, this estrogen level, it is also increasing. We know that the FSH level is high during follicular phase. Okay. But this estrogen level is also increasing. How? So this Graafian follicle, it will release estrogen. And this estrogen now will act on the endometrium. And this estrogen, as it is increasing in response to FSH, this estrogen will make the endometrial wall proliferative. Hence the name proliferative phase. This follicular phase is also known as proliferative phase. Okay, so done. Hypothalamus releasing GnRH that will act on the anterior pituitary, that will release FSH, and this FSH will act on the ovaries, and this ovaries, in this ovaries what's going on? So this Graafian follicle is growing, and this Graafian follicle will release estrogen. Okay, this was all about proliferative phase. Now let's talk about the ovulation. So once this follicular phase is done, there is LH surge. LH surge is when the LH reaches to a maximum point on day 14th or 15th. And because of this, there is ovulation. Now what is ovulation? Ovulation is actually this Graafian follicle rupturing and releasing the ovum. Here you can see, this is the Graafian follicle, and when there is LH surge, it releases ovum, whereas the remaining Graafian follicle will now develop into corpus luteum. Here, this is corpus luteum, the remaining follicle, and this remaining follicle, that is the corpus luteum, now this will release progesterone. This will release progesterone, and this progesterone, it will act on the endometrial wall, and it will make the endometrial wall secretory. Hence the name secretory phase. This luteal phase is also known as the secretory phase. Okay, here you can see there is LH surge and because of that there is rupture of the follicle, releasing ovum, that is ovulation. And after that ovulation, here you can see, after the ovulation this progesterone level, it is increasing. Why? In response to LH, the corpus luteum is releasing progesterone, and because of that the level of progesterone is increasing. Okay, but what if there is no fertilization? This ovum is waiting in the ampulla. It is waiting in the ampulla for fertilization, but there is no sperm, there is no fertilization. So it will wait for about 6 to 10 days. And if there is no fertilization, this corpus luteum will now start degenerating, and this corpus luteum will now become corpus albicans. And as this corpus luteum is degenerated, there is no progesterone production anymore. So this progesterone level will start decreasing. And if the progesterone level start decreasing, then it will start shedding of the endometrial wall, that is menses. How? We'll see. Okay, so done. Again, what was this? From day 1 to day 3 or 5, it was menstrual phase. From day 3 or 5 till 14, it is follicular phase, and the remaining is the luteal phase. On day 14 is ovulation. Okay, the main role is of FSH during follicular phase, and during the luteal phase it is because of LH surge. After LH surge starts the luteal phase, so it is because of LH surge. Now because of this FSH, what will happen? There will be growth of this Graafian follicle, and also the estrogen level will increase, whereas during the luteal phase there will be high level of progesterone. Okay, done. Let's move forward. Now in this picture you can clearly see that this is the uterine artery, and this uterine artery will further branch into arcuate artery. This arcuate artery will further branch into straight artery in the basal zone. Now this endometrium, it has two zones, two layers, basal layer and the functional layer. When we are saying that the endometrium will shed during menses, we are talking about this functional layer. This functional layer will shed. How? We'll talk about that. So this functional layer will shed, and this basal layer has straight artery, whereas the functional layer has spiral artery. This spinal artery is also known as spiral artery. Okay, now we know, wait, before we move towards the progesterone, let's also discuss about the glands. Here, this is the uterine glands. So other than the arteries, the endometrium also has this uterine glands. Okay, now let's move towards the progesterone. We know that during the luteal phase there is progesterone increase, but if there is no fertilization, therefore there will be no progesterone, so progesterone levels start decreasing. So progesterone, this progesterone, it is important for normal functioning of the spiral arteries. Now if there is no progesterone, therefore this spiral arteries will constrict. And because of this, the tissues, the endometrial tissues will shed during the menses. Okay, now let's discuss what happens in the endometrium actually. So in the endometrium, as already discussed, it is of the menses, it is of 3 to 5 days, sometimes till 7 days. So as you can see here, the spiral arteries and the uterine glands, everything is shedding off. And by the end of menses, there is nothing in the functional layer. stratum functionalis is absent now. But during the proliferative phase, that is the follicular phase, during the proliferative phase, there is repair and regeneration. This phase is all about regeneration. Regeneration of stratum functionalis, spiral arteries, and uterine glands. Now, the regeneration of spiral arteries, it's also known as angiogenesis. As you can see here, this spiral artery and the uterine glands, it's regenerating along with the stratum functionalis. Okay, this was about the proliferative phase. Now about the secretory phase. So the stratum functionalis, it will continue proliferating. As you can see here, it will continue proliferating, and also the spiral arteries will continue to proliferate. That is, angiogenesis will continue. But this phase, this secretory phase, it has a characteristic thing, that is the secretion of uterine glands. Secretion of what? So glycogen, proteins and lipids, it will be secreted in this phase, during this phase. Okay, let's talk about the length of the cycle. So the normal length of menstrual cycle is about 28 days. It's about 28 days. It may vary from -7 or +7 days, that is 21 or 35 days. But if the cycle is shorter than this 21 days, it is called polymenorrhea. And if the cycle is more than 35 days, it is called oligomenorrhea. This is abnormal. This is abnormal. But it can be normal. It can be normal during the 2 years after menarche or 3 years after 3 years before menopause. This is normal and it is associated with anovulation. Okay, this was all about the menstrual cycle. I hope you liked the video. If you liked the video, then do subscribe and hit the like button. Thank you.